Welcome back. Today, we'll be teaching you how to cycle an AMS 700 inflatable penile implant. Brought to you by Dr. Ryan Terlecki, Director of Wake Forest Men's Health. Congratulations on taking a big step to improve your quality of life. You've now joined the tens of thousands of men who have chosen to reclaim their sexual function by receiving a penile implant. Now that you've waited the customary 6 weeks, the time has come to start using the implant. Let's quickly review the design. The implant consists of 3 main components: the cylinders, the pump, and the reservoir. Today, we'll focus mainly on the pump. The inflation pump or bulb at the bottom is used to draw fluid from the reservoir and then send it out to the cylinders. The circular deflation button is located above the pump. Inside is a valve, also called a poppet, that can change direction. This is what allows you to maintain an erection for as long as you want, but to also have it stay relaxed when not in use. If we rotate the pump, you can get a sense for the height of the deflation button. If we rotate further, you'll see that the rectangular block around this button is flat on the back side. This is useful for orientation and elevating it to your finger or thumb when pressing the button. You want to avoid pressing this button by mistake when filling the implant. In this cartoon animation, we see the individual components. Upon pressing the bottom of the pump, the fluid enters the chambers to create an erection. To empty the chambers, the deflation button is pressed and held for several seconds. The fluid now leaves the cylinders and goes back to the reservoir. Let's demonstrate this with a model of an actual AMS 700. First, we easily locate the pump in the mid-scrotum. Instead of fingertips, I'll use a bent index finger below and thumb pad on top. The first pump moves the valve and feels similar to popping a piece of bubble wrap. Subsequent pumps are easier. As the skin in this area is delicate, I advise men to press gently at first. Allow time for the pump to refill with fluid after each squeeze. Recognize that longer cylinders will take more time to fill. For men with poor dexterity or decreased sensation in their hands, partners can be shown how to do this very easily. Once the penis is fully rigid, you can enjoy sexual activity for as long as desired. Let's watch again and fast forward. Watch how the model expands in length and girth. The tips of the cylinders rest behind the head of the penis and run through the shaft all the way to the back of the natural erectile tissue chambers. Now, let's go over how to put the implant back in a resting position. The thumb on the small circular button and finger behind is pressed together for around 4 seconds. You can often feel a vibration in your fingertips from the fluid going back to the reservoir as the cylinders come down. After letting go of the button, you can use your hands to empty the cylinders even further. This often allows for greater comfort and ease of urination. Gentle pressure near the end of the penis is maintained as the cylinders are compressed from the sides while working back towards the body. As with most things, this will get easier with practice. Now, let's address the elephant in the room: penile length. This is very important to most men and to many partners. It is also important to us as surgeons because we want to deliver the best possible outcome. In every penile implant procedure done at Wake Forest Men's Health, we place the largest device a man's erectile tissue chambers can safely hold. This is why we measure the internal anatomy and precisely customize the implant to each individual. Some men report that erections were longer in the past when function was normal or still responding to medication. With lack of regular erections, it is possible for tissue to atrophy, which can cause length to decrease. However, good news. Research has shown that with regular use of an inflatable implant, some recuperation in length can be achieved. The AMS 700 LGX, for example, can expand in length and girth if the tissue around it also expands to allow for this. Thus, to stretch this tissue, we encourage patients to follow a protocol aimed at length restoration. This involves the following. Pump up the implant until the pump feels firm, suggesting the cylinders are reasonably full. Wait 3 minutes and then try to pump a little more fluid as allowed. Wait 3 minutes again and try to add a little more. Wait another 3 minutes and then press the deflation button to bring the implant down. This 10-minute cycle can be done once each day, and many men find it easier to perform during or after a hot shower. Once again, congratulations on reaching this point. We hope you continue to enjoy the best in sexual health, and we're very proud and honored to be of service. So cheers to you. Thanks for watching. We hope this has been helpful. For more information, check out our website at wakeforestmenshealth.com. This can also take you over to our YouTube page to review other videos. If you'd like to be seen in our clinic, you can arrange a visit at the number shown on the screen. At Wake Forest Men's Health, our mission is helping men live better every day.